I just would like to give you the chance to tell people, as you're starting this job, kind of what your hopes are in terms of, what you're able to accomplish and what people should expect from you.
I think what I want to accomplish right now is making sure to start getting messaging out, because there's things that we just don't know yet. We're still learning quite a bit about it, but that in itself is valuable to communicate. That here's what we now know this last week. What's new? I think that like communication regarding the new strains that we're seeing in first in other countries and now we're seeing in different states. I think that's important to discuss the fact that the mutations that have been seen in this past week, while there's a couple different ones, they're all still regarding the protein, the spike protein, which is what these vaccines are targeting, so that there's every expectation that these vaccines will be just as equally effective against the new strains as what they are.
Are there other public health challenges that are spillover or related to COVID that you're seeing in public health now?
Yes, and one of those things is the rising sexually transmitted infections, and particularly the drug resistance of gonorrhea is always, for the last 10 years, that's been number 3 on the top 10 lists of things that are concerning at the CDC, and actually part of other, most of the world is very concerned about that. I mean, no one would expect that you may die from gonorrhea. It's always something that's been treatable, but there is rise of drug-resistant gonorrhea, and that's something we want to look out for.
What can you tell us about, what we're looking at for the flu season?
I did see 98% decrease in flu cases this year. Amazing. And so that is wonderful news, because people are getting immunized higher this year than other years. The fact that we're using the mask, we're washing our hands more, we're social distancing, all of those things are playing into this. As a consequence of that too, though, the concern is if we're taking such careful steps that our flu rates went down 98%, we're only seeing 2% of what we normally would at this time of year. COVID is that much more transmissible. Michigan is doing very well as a whole. The country, however, is not.
Are there other public health challenges that you see from the outside looking into Genesee County that you think are going to be kind of, front and center beyond COVID that need to be dealt with?
There's a lot of community concerns about trust in the area, and I personally like to get out and talk to people, and that's one of the things that I would like to do is create more of a open communication between different community groups and the health department. So I'm very excited. I'm really super excited about things. I think you have an amazing community with amazing involvement that I did not see necessarily elsewhere. And I really look forward to working with that level of enthusiasm and bringing a closer bond together.